The Queen is going to be making an address to the nation later on, urging us to maintain our self-discipline and resolve. Just how important is that message going to be?
Well, I welcome the fact that Her Majesty will be making one of these very rare addresses because it recognises what an extraordinary and difficult time this is for the nation. And this point about holding our resolve is so important. The vast majority of people are following the public health advice, which is absolutely critical, and staying at home. But there are a small minority of people who are still not doing that. It's quite unbelievable, frankly, to see that there are some people who are not following the advice. But the vast and overwhelming majority of people are. And so I hope that Her Majesty will lift the spirits and also thank everybody who is doing the right thing by staying at home, because that is the best way to control the spread of this virus and the fastest way to get us out of this.
You say it's unbelievable that some people are breaking the rules of the lockdown, but I just wonder if you could clarify a little bit about what we are and we aren't allowed to do. The weather is very lovely this weekend. Not everyone has a garden. Is it acceptable to sit down in the park and sunbathe if you are maintaining social distancing?
We're absolutely clear that you should not leave your home unless it's for one of four reasons: for medical reasons, to buy food, to go to work if you can't work at home, or for exercise. And of course I understand how difficult this is, but the problem is that when you go out, it's not only that you might directly interact with somebody closer than 2 meters, it's also that whenever that you can spread the virus through touching something which somebody else then touches, or you could pick it up that way. So we're crystal clear in the guidance of what people should and shouldn't do. That guidance is backed up in law. It is not a request, it is a requirement in law, and people need to follow it. And I just say this to the very small minority, as you say, of people who are choosing to flout the guidance. You are putting others' lives at risk, and you're putting yourself in harm's way. And so we are very, very clear about that guidance.
And so does that mean, just to be crystal clear, that sunbathing is against the law?
Sunbathing is against the rules that have been set out for important public health reasons. I wish I didn't have to say this, but I do, because the whole country wants to come through this crisis. The whole country wants to come through this, of course, as quickly as possible. And the fastest way to come through the crisis and to save lives and to protect the NHS and reduce the pressure on the NHS, the fastest way to do that is to follow the guidance and to stay at home unless you've got one of the four reasons that we've set out.
You say that at the same time, though, lots of people will feel that they're making a big sacrifice here, particularly those people who live in overcrowded accommodation, those people who perhaps have mental health issues, those people who may not even feel safe at home. You have your advisor going on saying that it could be lifted in a matter of weeks. Surely you need to provide some clarity here on how long we could be in this situation for.
Well, I'd love to be able to provide even more clarity than we have. We were clear when those who've gone into shielding, those who are the most medically vulnerable, we would expect that to last at least 12 weeks. But the truth is, and one of the difficulties of this situation that we're all in, one of the difficulties is that there are uncertainties. And there are uncertainties because we're still learning information about the disease itself, and the science continues to improve. But there's also uncertainties as to how quickly we can stop the spread of this virus, because it does depend very directly on how people behave. There's those rules so that we can get out of it as fast as possible.
Okay. According to the Mail on Sunday, there's a bit of a battle or debate going on between yourself and the Chancellor about when to lift the lockdown. Perhaps understandably, you've got an eye on the NHS, he has an eye on the economy. Do you recognise that?
No.
The big question, of course, is what is the government's long-term strategy for getting out of the lockdown?
Well, the first thing we have to do is flatten the curve and turn the curve of infections downwards. And we have seen some progress on that, but we're not there yet. And then once we've done that, we'll be able to think about the next steps, and we're doing the work on that. But we'll be able to set
What
that out.
What are those next steps? Because this is the critical thing. What are the next steps? Is it a vaccine? Is it treatment? Is it testing? What is the way out?
Well, we're working on all of those three, and they're all very important. Treatments to make sure that if we can improve the treatments, and if we can get the science behind the treatments better, then more people who become ill will be able to survive, and people will be less ill. A vaccine, of course, would be incredible, but it has to be safe and not do more harm than good. And it takes time to develop a vaccine like that. But in fact, the UK has put more funding into the global search for a vaccine than any other country. Strategy to increase the amount of testing.
Just want to ask about that testing, because many people say that that is one of the clearest ways out of the lockdown. You, of course, have set this aim to reach 100,000 tests a day by the end of April. But if you just look at the figures, at the minute, around 10,000 tests have been carried out a day. Just 11 days ago, Boris Johnson said that we'd have 250,000 tests a day, hopefully very soon. We're still stuck around 10,000. I mean, the numbers sound great. You want to believe them. But on this record, is that actually achievable?
Yes, it's going to be hard, and it's going to require an awful lot of people to put their shoulders to the wheel. In a way, it shows, this virus affects different people differently. I was lucky; I had 2 pretty rough days, and then I bounced back. And some people do get it pretty mildly, and then for others it's very, very serious. And the Prime Minister is not at that end of the spectrum. He's working away inside Downing Street, but he's protecting others by making sure that he too follows the clear public health advice, which is to self-isolate if you've got symptoms.
You can see why there is some concern about the health of the Prime Minister, though, at a time when he is still, of course, leading the response to what could be the biggest crisis since World War II. Doctors say that if a temperature persists for more than a week, more than 7 days, you could be at risk of developing pneumonia. Has he been visited by doctors?
I don't know, and even if I did, I wouldn't go into details in public. What I can say is that in dealing with him and working with him every day, he's in good spirits, but he's also being absolutely careful and cautious to follow public health advice, both for the direct impact and also as an example to the nation.
OK. Now, Labour has a new leader, Keir Starmer. He says he wants to work constructively with the government. Do you think we could ever see a government of national unity? The Queen is going to be making an address